Most people sign up for both Medicare Part A and Medicare Part B when they're first eligible. Part A is hospital insurance, and Part B is medical insurance. If you don't sign up when you are eligible, you may have to pay a late enrollment penalty. Your initial enrollment period lasts for 7 months. It is 3 months before you turn 65 through 3 months after the month you turn 65. If your birthday is on the first of the month, your enrollment period will start 4 months before you turn 65 and ends 2 months after the month you turn 65, but it's still 7 months. For example, if your birthday is April 17th, when you turn 65, your initial enrollment period would be January 1st through July 31st. If your birthday is October 1st, when you turn 65, your initial enrollment period would be June 1st through December 31st. If you don't sign up for Medicare coverage during your initial enrollment period, you may have to pay late enrollment penalties. The penalties are not a one-time fee, and the penalties will be added to your monthly Medicare premium. The penalties go up the longer you wait to sign up. First, let's look at the penalty that you would pay if you don't enroll in Part A on time. You only have to worry about a penalty for Part A if you don't qualify for premium-free Part A and have to buy Part A. You might receive premium-free Part A if you have one of the following. Number 1. You have at least 40 calendar quarters of work in any job where you paid Social Security taxes in the United States. Number 2. You are eligible for railroad retirement benefits. Number 3. You were a federal employee any time after December 31st, 1982. Number 4. You were state or local employee any time after March 31st, 1986. Number 5. You have a spouse that qualifies for premium-free Part A. So if you don't qualify for free premium Part A, and you don't buy it when you're first eligible for Medicare, your monthly premium may go up 10%. You'll have to pay the penalty for twice the number of years you didn't sign up. For example, if you were eligible for Part A for 2 years but didn't sign up, you'll have to pay the higher premium for 4 years. Usually, you don't have to pay a penalty if you meet certain conditions that allow you to sign up for Part A during a special enrollment period. We will discuss the special enrollment period a little later. When it comes to Medicare Part B, if you miss your 7-month initial enrollment period, you may have to wait to sign up, and you will pay a monthly late enrollment penalty for as long as you have Part B coverage. It's basically a lifetime penalty, and the penalty will go up the longer you wait. You'll pay an extra 10% for each year you could have signed up for Part B, but didn't. It's possible that you may have to pay a penalty for both Part B and Part A. Just as with Part A, you may not have to pay a Part B penalty if you qualify for a special enrollment period. Let's take a look at an example of a Part B penalty. If you were to wait 36 months to sign up for Part B and didn't qualify for a special enrollment period, you would have to pay a 30% late enrollment penalty. That's 10% for each full 12-month period that you could have signed up, and you would also have to pay your regular Part B premium on top of the penalty. If your 2023 Part B standard premium is $164.90, your total premium would be $164.90 plus a $49.57 late enrollment penalty, for a total monthly premium of $214.37. $214.37 would be rounded to the nearest 10 cents for an actual Part B monthly premium of $214.40. As we mentioned earlier, you can avoid a Part A penalty or a Part B late enrollment penalty if you qualify to enroll during a special enrollment period. A special enrollment period is only available for a limited time. If you don't sign up during your special enrollment period, you'll have to wait for the next general enrollment period. The general enrollment period is between January 1st and March 31st each year. If you qualify to enroll during a special enrollment period, you will fill out Form CMS-10797 and send the completed form to your local Social Security office. Please make sure that you contact Social Security as soon as possible to ask for this special enrollment period so you don't miss the opportunity to avoid penalties. You qualify for the special enrollment period if you fit any of the following situations: lost Medicaid coverage on or after January 1st of the current year, missed a chance to sign up because you, your authorized representative, your legal guardian, or your caregiver was impacted by a natural disaster or an emergency that's declared or starts on or after January 1st of the current year. Missed a chance to sign up because you got inaccurate or misleading information from your health plan or employer on or after January 1st of the current year. Were released from incarceration on or after January 1st of the current year and missed a chance to sign up while you were incarcerated. Have health insurance through your job, your spouse's job, or a family member's job, if you are disabled, and the person is still working. Have health insurance through your job, your spouse's job, or a family member's job, if you are disabled, and lose your group health plan coverage. Volunteer and serve in a foreign country. Have TRICARE. Missed a chance to sign up because you experienced other exceptional conditions. When it comes to Part D, you'll pay a penalty of an extra 1% for each month if you don't join a Medicare drug plan when you first get Medicare, or you go 63 days or more without creditable drug coverage. Creditable drug coverage could include drug coverage from a current or former employer or union, TRICARE, Indian Health Service, VA, or individual health insurance coverage. Generally, you won't have to pay a Part D penalty if you have creditable drug coverage that's similar in value to Part D, or you qualify for extra help. This monthly penalty is added for as long as you have Medicare drug coverage, even if you switch plans. So this is a lifetime penalty. Your penalty amount may change each year. For example, if you waited 14 months after you were eligible for Medicare to join a Medicare drug plan, and you didn't have creditable drug coverage, you'll have to pay a 14% late enrollment penalty in addition to your monthly plan premium. The penalty amount comes from the National Base Beneficiary Premium. This base premium is $32.74 in 2023. So your monthly Part D penalty would be $32.74 times the 14% penalty, which equals a $4.58 monthly penalty. $4.58 would be rounded to the nearest 10 cents to get a $4.60 monthly penalty for 2023. This amount would be added to your plan's monthly premium for 2023. After you join a Medicare drug plan, the plan will tell you if you have to pay a penalty. As we mentioned earlier, if you qualify for extra help, you can avoid paying a Part D penalty. Extra Help is a Medicare program to help people with limited income and resources pay Medicare Part D premiums, deductibles, co-insurance, and other costs. You automatically qualify for Extra Help if you have full Medicaid coverage, receive help from your state paying your Part B premiums, or if you receive Supplemental Security Income or SSI benefits from Social Security. If you don't automatically get Extra Help, you can apply for it by calling Social Security at 1-800-772-1213. TTY users can call 1-800-325-0778. We plan to make a video on the costs of Plan D and savings opportunities. Please subscribe in order to be notified when we release that video. As you can see, not enrolling in Medicare when you are eligible can affect you for the rest of your life. Please make sure that you set a reminder around your enrollment period. If you need to know more about the basic parts of Medicare, please click on the video on your screen.
This video was brought to you by licensed health insurance agents. Our goal is to explain Medicare insurance in a simple way. Please be sure to subscribe to keep up with our current videos. All the best to you, and be sure to join us in the next video.